Hi, I am Ian West, and this is the Electorate Podcast Special Edition. While I wish it were under better circumstances, healthcare is back at the forefront of American political discourse. And the primary reason for this is Luigi Mangione's assassination of United Healthcare CEO Brian Thompson. Now, it says a lot that this is what it took for people to reinvigorate the conversation surrounding healthcare in the United States. The 2024 election between Donald Trump and Kamala Harris seemed to leave this on the back burner, with neither candidate truly fleshing out their healthcare policies. Both were pretty busy running on other issues. But healthcare is so tied into the economic debate and what was the most important issue in this election, the economy, that I feel Democrats at least could have done a better job of linking the two together. So linking the cost of healthcare with cost in general and the economy and inflation. So the Affordable Care Act was really meant to be something of a starting point for healthcare reform. But since its introduction, it has stagnated, with no candidate since Barack Obama choosing to improve upon it. So where do we take healthcare in America? So Faiz Shakir, senior advisor for Bernie Sanders, appeared on the Ezra Klein show recently to discuss a few things. And in that discussion, he spoke about the way in which Bernie tended to govern. As we know, Bernie Sanders has some of the most progressive policies in the Democratic Party over the last several decades, but has often been one to sort of compromise to get incremental change through when necessary. So Faye stated that in the interview, while Bernie Sanders would run on Medicare for all or a single payer system or something like that, when it came time to actually getting something done, if he had to, he would be willing to compromise and say, okay, maybe we just lower the age of eligibility for Medicare in the United States from 65 years old down to 60-year-old. And while that's less exciting, it is tangible change, beneficial change. Now, this change would save employers in the United States billions of dollars on healthcare, but it would shift that burden to the federal government, which would make healthcare spending among the age group from 60 to 64, it would increase it by roughly $11 billion. Now, in part, this is because you would add 400,000 additional insured who are not currently insured, but it would increase healthcare spending among that age group, which is a high demand age group. That's the age at which you are still, most people are still working, but your health is starting to deteriorate a little bit. You have more need for health care, more doctor's visits, all that good stuff. So that is a high cost demographic. So shifting that away from employers, the idea would be that would reduce healthcare costs for all of the other age groups, because you wouldn't have that burden or that sucking from the health insurance companies. Now, whether or not that's actually what would happen, on paper it makes sense, but as we know, health insurance companies are out there to make a profit, right? That's what they're there to do. So is this what we're ultimately looking for when it comes to solving healthcare affordability in the United States, the crisis that we have? No, of course it's not. But incremental change can have its benefits. The risk you run is that if and when you implement this incremental change, so say you're lowering the age from 65 down to 60 for Medicare eligibility, if the other party wins the next election and wants to undo those changes, that's a very simple thing for them to undo. Okay, we're going to take that back up from 60 back to 65. And we have even had Republican lawmakers over the last couple of years talking about raising the eligibility. So taking it from 65 to 67, same with, retirement, raising the age for retirement. So if you can just do something that small, yeah, that's great. And short term, that is going to have a positive impact, but it's very easily undone. So it's less easy to undo something bigger and more robust, like a large healthcare package. So what is that bigger, more robust healthcare reform? It's single payer or Medicare for all. Now, you have kind of an uphill battle because when people hear those terms, and it's mostly due to the right-wing media propaganda machine, they instantly think, oh, socialism, big bad socialism. But Medicare for all and single-payer healthcare are really not that much different from the system we currently rely upon, right? Health insurance companies exist for one reason and one reason only: profit. They do not exist to help you. Their sole goal is to maximize the difference between what they pay out and what they take in, and that's it. Healthcare is already expensive, and then you add that bloated industry on top of it, and Americans are the ones left footing the bill. So how does a single payer system help this? It is essentially the same thing as insurance. So from your paycheck, the government takes out a premium during each pay period. That is your health insurance, okay, right? When it comes time to go to the doctor because you're sick, your claim is processed through the government's health insurance, that division. So it's effectively the same. As a citizen and as a holder of government healthcare, it is the exact same as insurance. But instead of maximizing profits, the government could run healthcare as a break even, right? Or even at a slight loss because it's a service provided to Americans. If you ran it at a loss, but coverage was good and everything was covered, then no problems. There would be fewer claims denials. The process for healthcare companies processing those insurance claims would become smoother and more efficient. Ideally, we would have a more transparent understanding of what our healthcare covers, and we wouldn't have to rely on our employers not picking the cheapest option that skimps out on coverage for us. Now, if the argument is that the government is inefficient when it comes to, basically everything they do, I'd probably tend to agree with that. But as technology in the space improves, there's less room for error and things naturally become smoother and less abrasive. And yes, there will likely be growing pains associated with the change, but when you make meaningful policy that is meant to have a lasting impact, that's always the case. You've always got to deal with growing pains in order to get better and in order to improve. And we can't really let that set us back because we've let this go on for too long. We have created an industry in the United States that is, no one should go bankrupt because they got sick. No one should go bankrupt because they got cancer. We have to find a way to solve this problem. And yes, it's not going to be perfect right off the bat, but we have to get started and we have to do it now. This is Ian West signing off on a special edition episode of The Electorate. I'll be back in your feeds next week, and thanks for listening. See ya.